And we are back. October is Breast Cancer Awareness Month, but what exactly does that mean for the Bronx community? And more specifically, are medical providers and community leaders doing to address the disparity in breast cancer for the Black community? Well, joining us to tell us a little bit more is Dr. Michelle Zhu, who is the breast surgeon at the Surgical Breast Care Program at Columbia New York Presbyterian Lawrence Hospital. And we welcome you to the show.
Thanks so much. Pleasure to be here.
Yes, and so as we are talking about Awareness Month, and of course we've got the color pink on for the awareness and
Yes.
to raise awareness, but a lot of people are still out there in terms of not knowing all that goes on concerning breast cancer. So particularly here in our area, the Bronx, what are we looking at in terms of numbers, statistics?
Well, breast cancer is very common, unfortunately, and for Black patients, actually, the disparity rates are the most extreme when we look at all the different ethnic groups. And so when we look at Hispanic patients, actually, there are lower mortality rates and lower incidence rates, which is wonderful. Overall, we're doing great in terms of treating breast cancer, but still there are disparities that are race-specific, and that's a problem. We don't want any disparities, and we don't want breast cancer at all.
Right, but talk about this. Any reason why we're seeing these disparities? Because everybody else talks about the disparities. Any particular reasons that are causes why?
It's multifactorial, so there are many different reasons why disparities may exist, but some of them include that Black women actually have a more aggressive form of breast cancer in many circumstances. It's called triple negative breast cancer, and it has treatment options just less than our more average breast cancer, which has the most treatment options.
And so when we talk about treatment, awareness, right, those are big things. First is awareness, right, and getting the word out. Are we seeing more and more people taking advantage of all the awareness that's being put out there? Are people coming in for testing? What are we seeing?
We are, but really, the most important thing a woman can do is know that a mammogram needs to happen. Mammograms save lives. It's screening. So our goal is to catch a cancer of the breast before you'd even feel it. So what would do that is an imaging study. So mammogram, get your mammogram, tell your sisters, tell your friends, go first of the month, go as a team, and you can support each other in getting that job done.
And there's also free clinics to go on throughout the course of the
That's right. There's mobile mammogram units. There are a lot of options. And so with our organization, we have plenty of options for women. And if you ever need advice about that, you can go to columbiasurgery.org, and there's information listed.
So when we talk a little bit about cities who've taken heed, research found that, that the number of Black women dying from breast cancer over the last 10 years, Chicago, those numbers. Here in New York, we know what the numbers are looking like. Let's talk about taking heed. What should a person be doing if diagnosed? Where do you go from there?
Okay, well, I just first want to make sure we communicate that breast cancer is a public health threat. This is so critical. And so if you feel a problem or you're not sure, ask your doctor. Your doctor or clinical provider will direct you to the next best steps. But the most important thing is to have awareness. So know yourself. Know if there's a change, and if you don't recognize a change, the most important thing is to get your mammogram. Right. You may not see a problem before it's even happening.
Symptoms, you talked about change, but be a little more specific. Somebody's watching right now and say, what are those symptoms? What are the changes that I should be paying attention and notice to? What are they?
So breast masses, that certainly is cause for being aware of yourself and getting to the doctor. Doesn't mean it's a cancer, but it could represent a cancer. A change in the breast like redness, oftentimes it's a breast infection. That's the more common cause of a redness, but a very rare form of breast cancer called inflammatory breast cancer could result in breast cancer. So it's just worth talking to your doctor. Again, you don't assume it's nothing. If your sign or symptom doesn't go away, you should seek care. See somebody about it.
And for people who are diagnosed, right, there's this huge fear, there's this huge worry. Give us a little bit more about it's going to be okay with help.
So most of the time, women do great. Really, if we look at all the data, breast cancer treatments have improved over time. Mortality rates for everyone have decreased over time. Yes, there are disparities that we need to eradicate, but in general, the treatments are better. So don't be afraid of going to get help. The earlier you go, the more easily we can treat you and get you on to moving forward and looking back at breast cancer as a thing of the past.
Right. So for resources that are available through you, share with our audience a little bit about the resources that are available.
So columbiasurgery.org, again, we have resources listed, but also there is a huge cancer center at the Lawrence site and at the Columbia New York Presbyterian site on 168th. And there are nurse practitioners, there are nurse navigators, there's surgeons, medical oncologists, radiation oncologists, social workers, whole team of doctors and providers ready to help you. So it's it's something where you're not walking it alone. It may feel scary, of course that it is, but you're with a team of people who want the best for you and will make sure you have the best outcomes.
All right, Dr. Michelle Azu, thank you so much for being with us.
You're welcome.
All righty, listen, now if you want more information, you're encouraged to make a good appointment. Call 914-787-3157. And how often should people be tested?
Well, it's controversial, but
Right.
once a year to twice a year, depending on your age group, ask your doctor, look at your risk factors in terms of family history. Your doctor will help guide you.
She's politically correct. I like her. All right,
I am.
don't go anywhere. We have more open coming up right after this. Thank you.